Great, how are you? Good. Now, Mayor, we do have hand sanitizer here. Compliments to the Department of Corrections. And the other bottle there is from Pacha Soap in Hastings. So, we got a couple. Well, good afternoon, everybody. Thank you very much for being here. I apologize for starting late. We had a few audio issues that we had to take care of, but I think we've gotten those resolved, and hopefully everybody can hear well right now. So thank you for joining us for our continuing communications on how the state is working to fight the spread of coronavirus here in Nebraska. And today we are making that final push for the next 3 weeks through the month of April. If you look at the models that are out there, they seem to indicate that we will hit our peak of the spread of the virus here in our state that last week of April. And so what we want to do is focus Nebraskans on redoubling their effort to be able to slow the spread of virus here in our state. Really call on people to exercise that personal responsibility and civic duty to slow the spread here in Nebraska. And really follow the campaign that we launched earlier this week around stay home, stay healthy, stay connected. And to that end, I am signing a proclamation today that will be for 21 days to keep Nebraska healthy. And again, the whole idea here is to emphasize the next 21 days are going to be critical in this fight against the coronavirus here in our state. And we really want Nebraskans to focus on the social distancing, personal hygiene, all the other things we've talked about to be able to make that happen. So first of all, I'm going to go ahead and sign this proclamation. So this is our proclamation for 21 days to stay at home and stay healthy. So we are officially proclaimed that we're focusing on this for the next 3 weeks, the next 21 days through the month of April. And as part of our proclamation here, we have our 6 rules rather, to stay home and keep Nebraska healthy. The first rule is stay home. We've been talking about this a lot. We want people to stay home. We want you to go to work. We want you to come home. Go shopping once a week. But when you go shopping, just that's all we want you to do. Or takeout. Actually, Nebraska is the number 2 state for takeout. You can go takeout, get takeout, bring that back home. I want you to stay home. Okay, that's what we're really focusing on, that stay home, no unnecessary errands. Make those trips, go that shopping one time a week or go get that takeout food. We want you to stay home. That's the first rule. Second rule, we want to make sure that everybody is socially distancing. When you go to work, we want you to go to work. But we want you to work from home when you can and socially distance if you're going into the office, keeping that 6-foot distance from people whenever possible. We want to focus on home and work. Then the third, I mentioned already, shop at home or shop alone. We want you to make a list. We talked about this last week. Make a list so you can be efficient. Go to the store, be efficient, get in, get out. One person from your family goes once per week. Don't take the kids. Shop alone. Fourth, help kids socially distance. We want people to help the children play at home. Don't have big groups of friends over for these next 3 weeks. Play at home. Don't go to the playground. Don't play group sports. Again, we really want to focus the next 3 weeks so that adults can help kids socially distance as well. The fifth rule is to help older Nebraskans. Maybe you can help them by running errands for them or doing their shopping for them. But it also means don't go visit folks in the long-term care facilities. We need to keep those folks separated so that the virus does not get into those facilities. But this is a part of our staying connected. Help other people in our community, and especially older folks. So help those folks. And then number 6, exercise at home in a socially distanced activity. So if you go for a walk, that's great. But remember, keep that social distance from other people while you're out for that walk. So these are the 6 rules to keep Nebraska healthy. Stay home. Keep Nebraska healthy. Here's our 6 rules we want everybody to follow for the next 21 days. and put that emphasis on these next 3 weeks to really knock down the spread of virus here in our state. And this is, again, something we're asking all Nebraskans to be a part of. Every Nebraskan has the ability to help us slow the spread of the virus here in Nebraska. Every Nebraskan can be part of this fight. And we're asking all of you to exercise that civic responsibility, that personal responsibility to be a part of this fight. Now, I know because we got the media here, there's going to be somebody who's going to ask, well, Governor, is this a shelter-at-home order? The answer is no. This is not a shelter-in-place. This is not that kind of thing. This is about asking Nebraskans to do what's right. Just do the right thing here. Stay home for the next 3 weeks. Don't do anything that you don't have that's not essential when you have to go out, right? Just do the essential things to go out. This is calling on people to exercise their freedom to do the right thing, that individual responsibility, that civic duty to do the right thing here in our state. Now, in addition to the proclamation that I signed and the effort we're going to continue to do around communication and these 6 rules that we have to stay home and keep Nebraska healthy for the next 3 weeks, we are also issuing a DHM, a directed health measure, that will really make more consistent some of the rules that we have here across the state. For example, some of our public health districts have issued rules around closing salons and tattoo parlors and massage therapy. We will be updating our DHM statewide that will cover those same sort of things. So that means that those salons, for example, will be closed statewide, not just in those DHM areas. It will also include things such as gentlemen clubs or bottle clubs. It will also include making sure that if we have group sports, like sports clubs and things like that, those will be prohibited until May 31st to line up with what we've done with regard to schools and extracurricular activities. So we'll be lining those up across there. And that full DHM will be available afterwards here as well. But again, we're really trying to make that more consistent across the state, and again, really make this push for the next 3 weeks to really limit the spread of the virus here in the state with that new directed health measure. In addition, we're going to be talking about what we're going to do for our healthcare workers and first responders with regard to lodgings. So if you're somebody who maybe works in a nursing home or a hospital, or you're police, firefighter, EMT, we want to make sure that if you want a place that you can go and just, not be a part of your regular circle so that you don't contact the virus, we want that lodging to be available for you. Now, the city of Lincoln already has this program in place, and the mayor will talk about that as well here in a little bit. But for those folks who may need access to this, the first thing we suggest you do is contact your employer. Many employers have this program in place. Many hospitals have this in place already, where if you want to go get a hotel room because you don't want to go home, maybe somebody in your family is sick and you don't want to go home, those programs are in place at many employers already. But if you do not, so check with your employer first, but if you do not, then you can call 833-220-0018. That's 833-220-0018. That is a toll-free number that is set up by the Department of Health and Human Services that you can call 24 hours a day. And if you need to get that hotel room because somebody in your family's sick and you don't want to go home and you don't want to pick up the virus and expose people at work to it, this is an opportunity for those healthcare workers and first responders to be able to have that place to go. Remember, again, check with your employer first to make sure they don't have a program like that already. But then you can call the 833 number, which is toll-free, and we will have somebody from the Department of Health and Human Services there 24 hours a day to help arrange those lodgings. Now, we are also working, as we mentioned earlier, on quarantine, isolation, and convalescence spaces for members of the public, for example, who maybe can't go back home because they've got people who are immunosuppressed at home, maybe they've had exposure to the virus, that sort of thing. We'll be providing more details on that in the future as we get those worked out. So we are working on those quarantine, isolation, and convalescence facilities, or be able to do that, but we're not prepared to talk about that today. We'll have more details on that in the future. But again, if you're law enforcement, first responder, healthcare worker, nursing home worker, you want to get that place to stay, call that 833-220-0018 number, and you will be able to get connected to the Department of Health and Human Services, who can arrange a hotel room for you so that you don't have to either expose yourself or expose family members by going back home. Also, we're going to be putting additional effort into long-term care facilities and rolling out new programs to help them. As we know that if the virus gets into a long-term care facility, it can be really devastating. We've seen that in places like Kirkland, Washington, right? So we have a program already in place where we work with long-term care facilities with regard to, say, doing webinars to help do education. We're going to be stepping that up to offer in-person training for those long-term care facilities. We're working with the University of Nebraska Medical Center to be able to do that. We also work with Nebraska Medicine and their ICAP program, which is their Infection Control Assessment and Promotion Program. And that ICAP program, working together with DHHS, is one of the things we do to be able to, for example, do an infection control survey for those long-term care facilities. I mentioned the webinars. We've got the in-person training. We also have the guidance document that we have up on the DHH website, again, using the ICAP protocols with regard to what do long-term care facilities do. And we also have infection control interventionists that are available also by phone. So we have a variety of resources out there for our long-term care facilities. And again, we want to do more of that training, including in-person training, to be able to help our long-term care facilities really understand what their current state is, what steps they can do to improve upon that, and of course, helping them understand what steps they take should have they have somebody identified as COVID positive in their facility, either among their population they're serving or among their workers. So that's another thing that we're going to continue to focus on, is that long-term care facility. Also, as part of this 21 days to stay home and stay healthy, we're going to be continuing to expand testing. We're going to be rolling out testing today and tomorrow in Kimball and Scotts Bluff. So you may recall that we had that set up in Grand Island this week. We're going to be putting a National Guard unit in Kimball. We're going to be doing more testing there. We're going to be doing more testing in Scotts Bluff. So you'll continue to see the state look for places where we need to do additional testing to have a better idea of what's going on in those areas. And I believe we're in yesterday was the last day of testing in Grand Island. Is that right, Dr. Antone? It was Monday, Tuesday, Wednesday? Right. So today's Thursday, right. So we're getting that set up. We're also being joined here today by the Mayor of Lincoln. Mayor Gaylor Baird is going to be talking about some of the things they got going on in Lincoln, and I presume going to reinforce the stay home message, right? Right, all right, good deal. So please, Mayor, will you please come up and say a few words?
Thank you, Governor Ricketts, for this invitation to be here today. I really appreciate the opportunity to amplify this incredibly important message to all of you Nebraskans who are tuning in. We want you to stay home and keep Nebraska healthy. And as our city and state continue our efforts to stifle the spread of COVID-19, I join the governor in emphasizing the message to stay home. The actions we take during the next 21 days are so critical to our success as a community and as a state. These new directives reflect the best guidance of our public health officials and experts at this time, and we are so fortunate to have them available to us, advising our local health departments and experts advising elected officials here in Nebraska to make sure that we're making the best decisions for our residents. In Lincoln, our health department, the Lincoln-Lancaster County Health Department, is leading our efforts to confront this pandemic. And we have had a hotline available to answer questions from our community members about COVID-19 and the health department's best guidance on how to manage life and work and operate a business during this time. By the end of business last night, our hotline in Lincoln-Lancaster County had answered 954 calls since it was started on March 23rd. We've also answered over 520 questions, specifically about the directed health measure that we have in place in Lincoln and Lancaster County that we put into place on March 26th. And we've had 305 contacts about suspected violations of social distancing through our Uplink app that our health department has been able to investigate and provide education about as needed. But what these numbers really say to me is, and give me confidence, is that our residents want to comply with these directed health measures and with the new measures that the governor is implementing today, which are so important as part of our evolution in our work to protect the health and safety of all Nebraskans. Simple actions like wearing a mask in public and limiting your essential grocery shopping visits to one per week, they really do make a difference. And in the absence of a vaccine, These prevention efforts are our best weapons in the fight against the coronavirus. You know, we've got first responders and healthcare workers on the front lines of this fight every day, and they still have to report to work. But one of the most heroic actions all of you can take is to stay home and keep Nebraska healthy. I'm grateful to the governor for his collaboration and ongoing regular communication with me and my office and all of the residents of Nebraska during this pandemic. And I want to thank him for this opportunity to speak to you and again reassure that this is working. These social distancing measures, while difficult, challenging, and posing disruption to our lives, they're working, and they're working in Nebraska. Keep them up, Nebraskans.
Thank you, Mayor, and I want to compliment the work that you're doing here in the city, because if you look at the testing and the rates of people testing positive, and Dr. Antone, I think this is still right, it's about 3% in Lincoln, is that right? 3.1%. 3.1% in Lincoln, just compared to statewide about 6.5%, and some of the other places that are even higher. So you're right, Lincolnites do want to do this. They do want to stay home and help prevent the slowest rise. So great job, people of Lincoln. Next, one of the things that we want to also talk about is how the state of Nebraska is working to help keep our teammates healthy and safe. We've had a number of questions about some of the things we've done. For example, we've got people working from home. We have people who are on ready to work status. We have got folks that are in our buildings but are socially distancing. And here to describe in more detail the things the state is doing to help keep our teammates healthy and safe is Jason Jackson, who's our Chief Human Resources Officer and our Director for the Department of Administrative Services. So Jason, will you come up and say a few words about what we're doing for our teammates? Thanks.
My pleasure, Governor, and thank you for the opportunity. Under Governor Ricketts' leadership, we directed all of our agencies the first week of March to begin the process of flexing this stay-at-home message while continuing essential services to Nebraskans. The governor directed all of our agency directors to apply their business continuity plans, which fortunately had been in development since the early years of this administration, and to apply, among many tactics, the opportunity for telework and socially distancing in the workplace so that we could continue essential services even while providing for the safety of our teammates and the public. And that's really important. We understand as an administration that as we work through this public health emergency, it's more important than ever that we maintain continuity of essential services to Nebraskans in need. And so those have been our two priorities, is really keeping our teammates safe, keeping the public safe, while also maintaining the continuity of those services. A key strategy has been applying telework and work from home and other distributed work styles, so that we can achieve work from social distancing in the workplace and keep our teammates safe. We estimate that fully 30% of our workforce right now is working from home or otherwise has a distributed work style. And that's really a remarkable operational achievement for state government, that we've been able to achieve that level of alternative work styles and maintain our same level of services to the public. So we feel really good about that. And we're continuing to work to build our capability every day. So we're flexing these new skills and adding to our capabilities and impressing upon all of our leaders that we need to be thinking about getting as much of our team as possible to socially distance in the workplace and think about alternative means of service delivery. One tactic among many is increasing the ability of technology that we're deploying to our teammates. We've received an additional 250 laptops just this week from our Office of the OCIO, and another 750 will be coming next week. And as we continue to ramp up that percentage of our workforce that has distributed work capability and technology and infrastructure, we can continue to achieve these stay-at-home objectives. Among other things we have going in state government is, again, just from a business practice perspective, impressing upon people the need to socially distance in the workplace. Keep 6 feet distance. Change that in-person meeting to a conference call. Do all those things you can to the extent that we can while continuing to deliver essential services to maintain distance from our coworkers so that we're not jeopardizing each other of getting sick. We've also, a couple of other affirmative steps that we've taken, directed all of our teammates and leaders, hey, if you're sick, stay home. If somebody in your household is sick, stay home. And we've extended leave benefits to all of our teammates so that if they're in one of those scenarios, they can have the peace of mind of knowing that they have income security, they can do right by themselves and their family and not jeopardize, exposing either the public or their coworkers to illness. We're taking steps to increase the janitorial services and cleanliness of all of our facilities, and just overall attempting to practice good business practices around social distancing in the workplace while maintaining a continuity of operations for essential services. And telework is one tactic among many to achieve that. So again, this is a reflection of years of work and leadership on the part of the governor to maintain essential business services even as we encounter unforeseen circumstances such as this pandemic, and prepare ourselves so that we could provide for our teammates' safety as well as that of the public, and continue to deliver essential services. So I'm going to hand it back to Governor Ricketts, and if there's any questions, we'll be happy to address them afterwards. Thank you, sir.
Thank you, Jason. And again, I just want to hit on that last point. We in government, we provide a lot of really important services. It is vital that we continue to provide those even through this health emergency and this pandemic to the people in Nebraska. And that's what we have worked to do, is to be able to provide those services while we're looking out for the health and safety of our teammates, either through teleworking or if in the workplace, making sure we're doing more around sanitation and cleanliness, doing more around social distancing, keeping that 6-foot distance, all of that. So we must keep our vital services going, and that's what we're doing here in state government, and we're doing it in a way to be able to keep our teammates healthy. So next, I just wanted, you've noticed I've been using the hand sanitizer from the Department of Corrections, but Strick Laboratories in Omaha is also making now hand sanitizer and providing it to Methodist Hospital, so we'd like to give them a shout out. We're trying to, again, find these organizations who do a great job and stepping up to meet the challenge of fighting the coronavirus here in our state. So I want to get a shout out to Strick Labs for their work with Methodist Hospital to provide that hand sanitizer, similar to what we've got with the Department of Corrections. You may remember yesterday I was talking about Pacha Soap in Hastings, who is providing hand sanitizer as well now too. And then just a reminder tonight, I will be on NET at 8:30. Speaking of Nebraska, be a program talking about what the state is doing with regard to coronavirus here in our state. I'll be joined by Tony Goins, who's our Director for Economic Development, talking about the Small Business Administration loans that are available, as well as Dr. James Lawler from UNMC. So with that, I'm going to go ahead and roll into the questions and answers that we have. Reminding people again that we've got 21 days to stay home and keep Nebraska healthy with our 6 rules for how we do that. So please, everybody remember that. So our first question here is from Henry Cordes, the Omaha World Herald. How sure are we that all coronavirus deaths are being counted in the state? What is the procedure for determining them? Is everyone who dies of a respiratory illness being tested for coronavirus? So the way it works is that the healthcare provider or the medical examiner is the one who makes the determinations of cause of death. That is an existing procedure that is already in place. So that person would be responsible for determining the cause of death, whether it was coronavirus or anything else. However, be mindful that anybody who goes into one of our hospitals with an undiagnosed case of pneumonia is being tested for coronavirus. That's, again, one of the screeners. That's the first thing. If you present to the hospital and you've got pneumonia, we don't know how you got it, it's an undiagnosed case, you're going to get tested. And obviously, if that person ends up passing away, we'll know that that person was a victim of the coronavirus. So again, the standard procedures that we have in place are determined for this as other causes of death. Christopher Burbaugh, Omaha World Herald. What is the intent of the executive order? Is it talking about the executive order I issued last night? Or was it 2 nights ago now? It's starting to blur a little bit. With regard to allow health departments to give 911 departments addresses to where people are were known to be tested COVID positive. Was this so 911 dispatchers can alert first responders before they are sent to those addresses? Actually, when I did that executive order, it was specifically about making sure that we could get information into our Nebraska Health Information System, or NEHI. So that statute was what I had to waive to be able to make sure we could get that information in, so we could pull together all the data from across the state with regard to hospital facilities and ventilators and patients and how many are in them and labs and all that sort of stuff, to make sure we had one unified look at the entire state so that we could do a good job of managing that and those, where we're deploying resources and where we have issues with hospital facilities and so forth. Now, in that statute was also the statute that prevented public health departments from giving information to law enforcement. So that statute is waived. I would urge that if law enforcement and public health department wants to get together, that's a local issue to decide how that information, if it will be if that information is going to be distributed, how it will be distributed. That's really up to the local public health department to work with law enforcement, bless you, Andrew, to be able to get done. So that's really a local issue to manage. I do want to emphasize, though, that even if law enforcement has information on, say, a house where somebody was tested positive, that is no guarantee that the next house that doesn't have that designation doesn't have coronavirus, right? So law enforcement really needs to treat every place they go as potentially having somebody with coronavirus because, again, the virus spreads quickly. You never know who may be exposed. So I think any person they come in contact with, they want to treat like they potentially have the coronavirus. Joanne Young, I want to know what the governor thinks of the $2 per hour request for differential pay. Again, that was a request from one of the unions here at the state of Nebraska. And look, folks, first of all, we provide essential services. We have to continue to provide those essential services. That's something that we at the state are responsible for doing. Everybody who works here knows that we provide those essential services. We also all know every organization in the state is going through challenging times. Everybody is trying to figure out how they work with fewer people, how they work with people at home, but also how they continue to serve the public. Right? We have essential services that have to be done at all levels of the state. So we're all in this together, and we must be mindful of that as we go forward. So we're all working hard. We're all doing things together. That's what we have to keep the mission on. You know, if you're talking about differential pay, everybody's working hard. So everybody's got to be out there working. We're all in this together. From Grant Schulte of the Associated Press. The Strategic National Stockpile is nearly out of personal protective equipment, and some states are trying new strategies to get equipment they need. California is using their market leverage to buy a lot of equipment and then distribute it to other states. Is Nebraska participating in any sort of consortium to increase its purchasing power? Has the state tried any other strategies like that? And then also in here, about how much has Nebraska spent so far on PPE and ventilators? And the next question is just about the response letter from the Nebraska Association of Public Employees, and I did address that one already. So with regard to purchasing power, we are not a part of a consortium with other states, though we'd certainly be open to looking at things like that. But we are looking to leverage relationships that we have to be able to get PPE into the state. And while kind of analogous to what California is doing with other states, we're doing with organizations here statewide in Nebraska. So the state of Nebraska is looking to use our buying power as a state to be able to buy more PPE, PPE for hospitals and EMTs and, healthcare clinics and nursing homes, all those different organizations that may be challenged right now in their own supply lines because of the demand out there. We're trying to get a handle on what are their needs. We've asked everybody to turn that in about 2 weeks ago. We actually sent out to our public health departments a request for getting that information back in. So we're using that response to be able to inform our purchases of PPE from around the world to be able to get it back here. So far, I mentioned earlier in the week, we'd received 500,000 gloves last week, 97,000 N95 masks on Monday. We spent about $275,000 so far on getting supplies in here, and that number will continue to go up as we get more PPE in. So we are looking to continue to make large purchases. We're starting to see some of those supplies come in, and we look to be able to provide that PPE to those local public health districts who can then distribute it out to the folks in their communities who have a need. Jack Williams, NET, we'd like to hear what Commissioner Albin has to say about the latest jobless numbers. Any chance he'll be at the podium? Better than he thought, worse, leveling out and so forth. Is Commissioner Albin in the next room? Oh, he's over here. So as a matter of fact, we do happen to have Commissioner Albin here. We've got 26,562 new applications for unemployment last week. That, again, is a third week in a row that we've got a new record. So we continue to see that the state is being impacted by the coronavirus and that people in the state are losing their jobs and seeking those unemployment benefits. So, Commissioner Albin, I'll ask you to come up and talk a little bit about that.
Thank you, Governor. We were not totally surprised by the numbers in the sense that they had been on the uptick there for the last few weeks, and So the number wasn't totally surprising. It was nice that it wasn't a huge jump. You know, the week before, we jumped by almost 10,000, and last week it was only 2,000. And what we've seen so far this week indicates that we may have crested in terms of the number of claims. New claims. I hesitate to say that because it's Thursday and Friday have been really heavy days the last couple months, but our last couple weeks. But at this point, it looks like we may be at that crest. We'll have to wait and see. And what was the second part of that question? Or was there?
It's right there in front of you there, right here. Did you think it was better than you thought, worse? Is it leveling out?
Yeah, I think so. Yeah, it's about what we had expected. Does seem to be leveling out, maybe even dropping back a little bit.
Thanks, Commissioner. And again, I know we've been challenged to process all these applications when we have these records. Again, going back to 2008, the record had been 4,000 before the current pandemic. And I think that you've not only doubled your staff, you're getting volunteers in from other agencies and looking to get outside resources as well to be able to help get adjudicators for those applications. Is that accurate?
That is absolutely accurate.
Great. So we are working to staff that up so we can process those claims as quickly as possible. But again, it is going to be a challenge with the volume of work that we've been receiving in. All right, Taylor, do you have other questions?
We do. We have a couple of questions from KPTM.
Okay, KPTM has questions.
Is there a chance this proclamation will be extended past 21 days?
So is there a chance this proclamation will be established or be extended past 21 days? Well, the idea is that if everybody stays home here for the next 21 days and practice these 6 rules to keep Nebraska healthy, that we should really take a whack at the spread of the virus. Again, we're expecting that we're going to peak the last week of April. So if everybody does all these things, we should really knock this virus down. Now, we are going to reevaluate as we get toward the end of April, because we also have a directed health measure that is set to expire. The President's 10-person rules is set to expire April 30. And, we will use every tool in our toolbox to be able to address the issues we have with regard to making sure we slow the spread of virus here in our state. But given that we have seen really good compliance from Nebraskans so far with regard to the social distancing rules and the other things we've done with regard to like the 10-person rule and the other non-pharmacological interventions, we want to just keep that effort going. We can't get complacent. We need to redouble our efforts for the next 3 weeks here and really work as Nebraskans to stay home, stay healthy, stay connected, really work on getting that done, because we've got to get this knocked down, and this will help us then get back to a more normal life after we get the virus under control. So I can't tell you how that's going to work out, but our expectation is if we can really do a good job here, as we get into May, we can start looking at loosening some of the restrictions if we've gotten it knocked down here. And again, I'll just go back to what Coach John Cook said a couple of weeks ago. Hey, if you want to watch football in the fall, stay home now. If you're one of those high school grads that wants to have a commencement ceremony in person in August, stay home now.
We have a question for John Alban. KPTM would also like to know, do we have updates on when people can expect to get their unemployment? They have some folks saying that they haven't gotten an unemployment check even though they filed one.
So actually, Commissioner Albert, I'm going to go take a crack at this one, and you tell me if I got it wrong, okay? So the question was about, hey, when can people expect to receive an unemployment check once they've got it filed? And typically, the time to process those is 21 to 28 days. Is that right, Commissioner Albin? So that's typically our goal, is to get those processed in 21 to 28 days. We have waived the 1-week waiting period. So normally, when you apply for unemployment benefits, you have to wait a week. We've waived that week. We've waived the work requirements and everything. So now it's really about just getting it processed. But again, you can see with the volume of work we're getting in, it's going to be very tough to meet that 21 to 28 days. We are working to hit probably that 28 days, but that's part of the challenge. Is it's still going to take, those 4 weeks to get it processed and get those checks out. Is there anything you want to add to that?
We realize that's everyone's concern. We did have the 11,000, almost 12,000 claims that we paid out in the last few weeks. Actually, over 10,000 of those are within 7 days, so we have not been slacking off. It would be foolish to say we're going to keep that pace up, but we're working as fast as we can. I think in terms of adding to our bandwidth, the other agencies, thanks to Jason Jackson for leading up the charge, we're going to have at least 50 adjudicators come in borrowed from other agencies, and then our hope is to add another 100 outside staff sometime next week. So we recognize it's important to get that money out as quickly as possible, and we're moving heaven and earth to try and get that done.
We have two questions from Rob McCartney. He says.
From Rob McCartney.
Are you planning to close parks?
So the question was, are you planning on closing parks? Game and Parks has closed campgrounds across the state, and Game and Parks is an independent agency, so they've got their own board that works with their executive director to make those decisions. Like I said, they have closed the campsites. With regard to city parks, that would be up to the cities to be able to make those determinations.
He also says that South Dakotans are coming to Gavin's Point Dam, which is between Nebraska and South Dakota, to fish, and people are concerned about a need for those folks to quarantine. Is there anything that you would have to say about that?
So the question was, people coming to Gavin's Point to fish. Now, it seems to me that if you are coming to fish and you're staying in a boat, that they're probably not having more than 10 people. Maybe if you have 1 or 2 people in a boat and you can stay, you know, a few feet apart, that sounds like a pretty good activity to do. Again, what we really want to emphasize is if you're coming to the state, one of those snowbirds coming back, you've been traveling in another part of the country, maybe you've got a cabin here and you're coming back, we really want those people to quarantine for 2 weeks. But again, if you're a South Dakotan and you're on the other side of the river, you know, the lake, and you're just coming into the lake to fish, you know, I think that, again, we want people to use as common sense and good judgment.
We have a couple questions from Melanie Standerford at KNOP. She wants to know if plumbers and electricians can still do their jobs under the new DHM.
So from KNOP, can plumbers and electricians still do their jobs? Absolutely, yes. We want people to go to work. We just want them to practice those good social guidelines. This is about staying home and not doing non-essential errands. It's about shopping 1 time a week. It's about going to get takeout from the restaurant. But it is absolutely about people continuing to do work, especially those essential functions like plumbers and electricians.
What should mixed families do for the holidays, like kids with mom or dad switching houses on the weekends and holidays? Do we have any advice for them?
So what should mixed families do with regard to the holidays? You know, again, with Easter coming up, what we'd really like to see is that you celebrate with the people in your household. Obviously, if you've got mixed families, you may have to make other accommodations to be able to do that. But again, we tell people just use your common sense and best judgment. If the kids have to split time between each parent's home on Easter, well then just split time between, you know, maybe it's between the home on Easter, or if it's Saturday or Sunday or whatever it is. But, you know, we certainly are not trying to break up families here, but we do want to limit the size of those gatherings. Again, keep those gatherings to 10 people or less.
Last question from Melanie at KNOP is, can you still golf under the new DHM?
And can you still golf under the new DHM? So again, we want people to practice good social distancing. If you can manage the golfing and you're not, you know, we want you to get out and do some exercise and that sort of thing, and you can do it socially distanced, appropriate way, that's great. But let's ask yourself this, do you really need to go out and golf? Or can you find another way to exercise? Can you really help us stay home and stay healthy? That's what I would urge people to really think about. How can I, for the next 3 weeks, can I give up my golf game to help slow the spread of coronavirus here in our state? Can I give up my golf game or the other things that I want to do over the next 3 weeks to help protect the most vulnerable people here in our state? That's what we're talking about here, folks. We're talking about if this virus gets into you know, things like nursing homes, people who are older, who have those underlying health conditions, it can be devastating. We're trying to protect the most vulnerable people here in our state. So ask yourself the question, you know, can I give up something to help protect my fellow Nebraskans? That's what this is about. So really ask yourself that question. We want people to get out and get exercise, but ask yourself, can I find a different way to do it for 3 weeks?
Bill from KNAB in Scottsbluff wants to know if the proclamation is replacing the DHMs, which are longer.
So the question from, where are we coming from?
KNAB.
KNV was about, is the proclamation replacing the DHMs? That is not the case at all. The DHMs are still in force. As I said, we're just issuing another DHM that actually goes beyond our previous DHMs as well. So the proclamation is about really highlighting the 21 days to stay home and keep Nebraska healthy.
Final question from submitted questions is, are gyms and fitness centers under the new DHM? And this is also from KPTM.
So with regard to gyms and fitness centers, again, we didn't, they're not as part of the DHM unless you cannot do that social distancing, the 6 feet. We want people, again, to stay healthy. But if you're in a smaller facility where you can't put the equipment 6 feet apart, then that's a problem. So you gotta be able to keep that 6-foot distance between the workout machines where people are working out. And again, all the same common sense stuff about sanitizing frequently and using lots of cleaner and all that sort of good stuff. Again, there's lots of great opportunities. I know the weather's not gonna be great the next couple days, but as we get into April, we should get nicer days. Exercising using a socially distance activity would be the things we want to recommend. All right, so those are the questions we got. Let's take questions from the studio audience. Martha, come on, you always got questions. All right, Martha.
Okay, these 6 rules, these are not enforceable like the DHMs are, so these are more like guidelines or.
Well, again, Martha, so as I've talked to people, and again, we talked about, some of the things, the states that have shelter homes. Well, even in shelter home states, guess what? You have people that aren't paying attention to those. What we're really trying to do is get the message out to Nebraskans. Look, I know Nebraskans. They want to do the right thing. You ask them to do the right thing, they'll do it. And the right thing is, for the next 3 weeks, stay home. We're trying to slow the spread of virus here in our state. So we're giving these rules so that we can be specific about what we mean by stay home, right? So we want you to go to work. We want you to go to that takeout restaurant. We want you to go shopping once a week, but only go by yourself. Don't take the whole family. And be efficient, right? Just go in, get out. Just do the essentials for the next 3 weeks. That's what these 6 rules to stay home and keep Nebraska healthier about. Andrew.
So can my nephew see his girlfriend, or should he stay home?
Can my nephew go see his girlfriend, or should he stay at home? That was Andrew's question. So for the next 3 weeks, we say, hey, just stay at home. Okay, so talk to her on the phone, use Skype, use Zoom, something like that. Your relationship will survive. Look, everybody's going through the same thing. Nobody's gonna come and take your girlfriend away from you right now because you can't go date anybody else either, okay? So you're fine. Just do it on Zoom.
I had a
Yeah.
question for Commissioner about the
Commissioner.
You've seen claims, is there an estimation on how much money we're gonna see through all of these? I know it varies for different individuals, but is there any estimation on how much you've given out and how much there is expected?
Well, I know how much we've given out this week, or paid out this week, and that's about $3.2 million, but that vastly understates the actual amount that we'll end up paying in respect to that week. We're still doing some calculations on all of that in terms of the number of claims, but it will be substantially higher than that when we actually get all the weeks paid for this last week.
Can you put in relativity how, we know these numbers are much higher than a week in January this year. Can you kind of estimate how much you would have seen in weeks prior and months prior compared to 3.2 million?
I don't have all the numbers in front of me. It's published on our website, so that's probably the best source to go. We've more than doubled in the last few weeks, and I'm sure we'll more than double again.
Commissioner, while you're there, at the time that this started, you said that the unemployment fund was strong, and so the state could afford to do not charge experience with the claims against companies. And so, given what's happened since then, is that still looking as healthy?
Well, obviously, the fund is going to take a hit, especially after we get all of these months calculated, and we're assessing that. In fact, I've had people working on it all this week. But we anticipate that, if the state's back in business midway, early June, it'll be a big hit to the fund, but it's certainly nothing that will stretch it or put us toward insolvency at that point.
So despite all the claims, you say you can make it to the middle of June?
Yeah, I don't think there's any problem with us getting to the middle of June.
And did you have a question for the Commissioner?
It's about that, allowing for medical personnel, health officials, as well as first responders to kind of have.
The lodging, yeah.
The lodging and things like that. How is that paid for? And also, is that extended to like correctional workers as well as 24-hour facilities like the regional center?
Yeah, so the question was with regard to the lodging that we were talking about earlier as part of our overall effort to be able to slow the spread of virus here in our state for our healthcare workers and first responders, is who's paying for that? That the state is paying for that. So that is going to be something that we will pick up to make sure that, again, our healthcare workers, if your employer doesn't already have a program in place, can find that place to stay to make sure that they're not being exposed or exposing their families to the coronavirus. Would that apply to correctional officers? Again, same sort of thing. We'll make that available to correctional officers to be able to do the same sort of thing. The whole idea is these folks are on the front lines, whether it's our healthcare workers, our EMTs, our firefighters, our police, our correctional workers, these public safety folks. If they need a place to be able to go so that they can keep working, we're going to provide that place.
Governor, I want to ask you about the primary election. I know some states like Wisconsin recently allowed curbside voting. I don't know if that's anything you're under considering here in Nebraska, maybe for people that want to vote on election day but are hesitant to go inside a building and vote.
So the question was about the primary election and curbside voting. We are not doing that here in Nebraska, but what we have done is mail out to everybody the early ballot voting request form. It's that green card you received in the mail. So please, take advantage of that, fill it out. It's due by May 1st. You get a ballot sent you in the mail. You can fill it out, you can mail it in, you can drop it off in your county drop box. That would be the way to be able to get that done ahead of time. It's a great way to participate. The polls will be open May 1st. Secretary Evans is working with his election commissioners to provide, masks and gloves and sanitizers to make sure that we've got all that for our polling places. But if you'd prefer to avoid the polling places on polling day, fill out that early ballot voting request form. Andrew.
I'm a little fuzzy on the proclamation. I mean, other than maybe adding an exclamation point on every one of those things, what does it do?
Well, like many of our proclamations, it's about reinforcing a point and a message. So I don't know if you've been to our proclamation ceremonies that we have monthly. This is another way for us to really put that exclamation point, as you suggest, on the things we want people to do around staying home, staying healthy, our 6 rules for staying home and staying healthy. This is about really emphasizing that to let Nebraskans know we need to all make this final push over these last 21 days to be able to knock the virus down here in our state. Martha.
Governor, I know that we've heard about state employees and some of the things that are being done, but I know that we've heard from a number of employees who are concerned that they are not able to work from home and that they're not able to observe the 6-foot distance in their jobs.
So the
And this goes even for jobs that are not like correctional workers where they have, you obviously have to be there, but jobs that could be done from home, but they're not allowed to do it.
Well, so the question was, there are some of our teammates who, can't work from home, they can't socially distance at work, and that's not different from a lot of other professions as well, right? Where we know that we've got things we gotta do, there are vital services we gotta perform. For example, 2 utility workers at the top of a cherry picker can't necessarily stay 6 feet apart. Think about our manufacturing facilities, especially for food processing, which are vital to keeping our supply chains open. Those folks have to be able to continue to go to work and again, take steps to be able to do the best they can to slow the virus, but they're still gonna have to show up and work in a manufacturing environment. If there are specific people that say they could be working from home, ask them to document that. If people say they could be working from home but can't work from home, certainly love to hear about it. Ask them to document it, send it in to us. We'll certainly take a look at it. But I know that all of our managers are working very, very hard. As Jason said already, we've got a lot of our associates that are working from home right now. We had folks who are on ready-to-work status. We got people who are volunteering to go work at the Department of Labor. So, we're doing the best job we can. But hey, I got to remind everybody, we perform vital services to the state. If these weren't vital services, we wouldn't need people to do them. So we need to perform these services to serve the people in Nebraska, especially at a time when we've got a public health emergency. We need to perform these services, whether it's going to be something that is done in the Department of Labor or the Department of Revenue. There are definitely going to be office jobs that can only be done on site, and we have to have people to do that.
We have time for 2 more questions.
2 more questions. Yeah.
I know that the Trump administration yesterday allowed pharmacists to conduct coronavirus testing. One, is this something that you're thinking about implementing
So the question was, some pharmacies are doing coronavirus testing. I think I saw something maybe about CVS. Was that kind of one of the things I saw? We're actually going to take a look at that as well and kind of see what's going on there. I think, again, the issue we have in testing is not that we don't have people who want to do the testing, but the limits on reagents that we have to actually do the test. So we've got, the swabs and test tubes, but we have to have the reagents to actually run the test to be able to know whether that is positive or negative. And that's the rate limiting factor we got right now. I've been on the phone all week with vendors who sell those reagents and working with them to be able to supply us so that we can expand the amount of testing we're doing. As we get more reagents in, we will expand more testing. But right now, it's an issue where we just don't have the issues to be able to do it. And I don't know with those pharmacies if maybe they're sending them out to the commercial labs like Quest and LabCorp, and maybe that's what they're doing. That's a little bit, I know some healthcare providers are doing that here in our state. And that's generally a 4 to 7 days or longer turnaround time. So I don't know all the specifics about how those pharmacies are doing it. We're going to look into it. But again, we're doing what we can do with the reagents we have, and that's really the rate limiting factor right now. One more question. All right, seeing no more questions, I'm going to go ahead and wrap it up. But again, I really want to emphasize, folks, we've got 21 days in the month of April. We're supposed to reach the peak of the virus here that last week of April. Now is the time for every Nebraskan to be a part of this fight, to take that personal responsibility to find ways to fight the spread of virus here in our state. And that means stay home, use our 6 rules, keep Nebraska healthy. That's what we got to focus on for the next 3 weeks, to really knock the virus down here in our state. So thanks again to all the Nebraskans who are working so hard to prevent the spread of virus here in our state. And we will see you all back here again tomorrow. And then next week on Monday, Taylor, I believe, since I've got my radio call-in show, we are moving up the time of the press conference to what time?
1 o'clock. And the rest of the days.
So Monday next week, the press conference will be at 1 p.m. Central Time. The rest of them will be at 2 p.m. Central Time. So because of my radio call-in show, we will do the press conference early at 1 p.m. Thanks again, folks. Appreciate it, and we'll see you tomorrow. Thank you, Commissioner Albin. Thank you, Francis.